Well, good morning, everyone, and welcome. We're going to do a couple different things on the presentation. I'm going to talk a little bit about vision casting, a future focus on how occupational health will actually transform our communities. A couple of these slides will run through some audience participation questions. So in the spirit of Dr. Truce's let's get up every 30 minutes, when I ask the question, if it pertains to you and is relevant, please do stand up. And I'd like for you to take a look around the room to note who is standing up as individuals are responding, because really the purpose of conferences and overall technical sessions like this one is not just to listen and learn of the information that we're presenting, but really to take that into a network collaborative and bounce off the ideas from each other, all right? So we'll go ahead and stand as we go through the questions. The first question, just as a practice, how many in the audience are from BAPCO? Please stand. All right, great. This is a strong BAPCO presence today. All right. So with every technical presentation, I like to always do a little bit of conference summary of what is the relevancy of this particular technical session to the conference overall. So here are some of my takeaways from day one, where in the excellent executive panel session yesterday with the CEOs, the key takeaway was companies are economic drivers, and HSE is a key performance indicator that impacts profitability. And then through the technical sessions yesterday afternoon, we really talked about corporate expansion of the health component requires adoption of corporate wellness programs. That has to be in place before expansion of HSE through a health aspect can really be broadcasted further for our organizations. So with that conference summation, let's vision cast into the future, because the topic of the overall conference is how do we take the challenges of today and maximize resiliency in the future? So let's take those learnings and talk through an opportunity for change. If we look at this, the opportunity for resilience of all the different sessions that we've talked about to date lends an opportunity for us to support effectively deployed and consistently reinforced corporate health, safety, and environment standards can not only transform corporate culture, but it can extend into impacts to community development and community advancement. So more simplified, we say, applied HSE shall transform communities. So to make it even simpler, we're going to do some questions, and this is where everyone, through Q&A response, you're just going to stand. How many individuals have participated in their company's corporate wellness programs? Stand if you've participated in your company's corporate wellness programs. Okay? Then please sit. How many individuals have taken learnings from their company's corporate wellness programs and taught their family members some of those principles? Please stand. Okay, interesting. So you've taken what you've learned from your company, you've applied it to your families, and I'm sure there have been very good overall impacts. Now, who's gone the next step further in taking corporate wellness programs, occupational health programs, corporate policy standards, and expanded that to their philanthropic participation? So extending that beyond your family into your communities. Please stand. Excellent. Round of applause for those of you who have done that. That's phenomenal. Way to extend into. So when we look at this, if we're going to tie in occupational health to wellness programs, to the vision casting of community health and transformative change, we really have to understand the definition of each of those areas. So you all know this because you have gone through this several times already, this conference and previous conferences, but these are the 5 main objectives of the World Health Organization. We have actually achieved these 5 objectives because this was the World Health Organization plan from 2008 to 2017, and per WHO, they're now working on the next 10 years. So congratulations to everyone in the room. We have completed our objectives from the World Health Organization's focus. And so if you take occupational health in just those 5 objectives, and we extend into what does that mean for corporate wellness, let's focus for a moment on the definition of corporate wellness. From a corporate wellness perspective, we take this is an oversimplified model of the World Health Organization's population health-based model, where we say corporate wellness programs are impactful if and only when you have programs well-planned that lead into activities that support a measurement and link to care from both a systems measurement perspective and a systems capacity perspective. And then as you tweak, change, and improve those overall programs by adding additional customizations based upon assessments of those populations. The overall impact of that is better care, better health access, and reduction of cost. So now if we take occupational health and corporate wellness and we merge those two concepts, how does that actually impart a more impactful strategy when we look at the role of that particular program combined in its impact to the individual employee, the organization, and the corporate culture? So when corporate well-being and corporate wellness programs promote overall corporate well-being, we are actually achieving better operational excellence. So this is how the objectives on specifically occupational health line up to corporate wellness programs. And thereby corporate wellness programs are actually impacting ongoing improvement and development strategies within occupational health overall industry practices. Okay? The overall merger impacts are identified there. I won't read them to you, but the overall impact is in combining both the occupational health and wellness strategies. You now have a comprehensive scorecard measuring not only industry benchmarks, but personnel performance indicators, and most specifically, individual improvement lending to better behaviors that impact the entire merger. So when we talk about community health, which is the next apex, we've got occupational health, expanding occupational health into well-being programs, and then adopting it on a community-based model. We want to take a look at what is truly the definition of community health, and how does that align to the wellness programs that we see within our organizations. So community health is simply a study and improvement on a specific geography. How many of our communities, how many individuals actually reside and or work on corporate campuses? Please stand. Corporate campuses. So when you say corporate, okay, good, 2. How many individuals travel, and please sit, thank you. How many individuals commute to work every day from their home to their physical office? Okay, great. Wonderful, please sit. Do we have any remote workers? Anyone that has the lovely privilege of working from home? Anyone? No? Okay. So one day a week, great. So when we look at that, where you physically are is an impact of where you physically are is an impact to your health based upon the community. So when you're working from home, and hopefully you're eating healthier, versus when you're eating in the campus cafeteria, versus when you're walking versus commuting, those are all impacts of community health. And when we look at community health, we're really taking a look at how local resources, access to care, and health equity combine into an overall sphere of influence on the public policy side. We can get into much further details about community health, but this is the overall view on how community health, through navigation, innovation, and education, will support further progress of frameworks in public policy and support further adoption of progress within looking at overall social policy within an organization. That organization lends to the community at large, which public policy changes and lends to the entire country model change that will impact the overall citizens and also workers of that community. I'll give you a key example of local resources. So our corporate headquarters is in the state of Indiana. And as the state of Indiana, we are very behind in many health system benchmarks. So one particular area is in the occupation of healthcare workers. When we look at the overall employment statistics, for 20 million people in the state of Indiana, we have 140,000 healthcare workers, with the least distribution amount in the mental health and overall psychological support systems within the state. Employment numbers are pretty self-explanatory. That's the number of total individuals employed in this particular occupation in the state. The location quotient is a benchmarking tool. So just as in occupational health, we have performance indicators, and just as in wellness programs, we have measurement indices of how well the program is performing, in community health, we also have benchmarks and indicators of what is the resource and supply of that overall profession to support better community upbringing and overall community progress. These are very common statistic elements that for the Kingdom of Bahrain and other countries within the GCC should be looked at as an overall candidacy pipeline to support local resource expansion and support. When we look at local access to care, another example given is how often is access to care actually identified? How often is it being utilized? And what is the overall follow-up support for each of those individuals? So a couple of statistics there, with the measurement being system capacity and overall skills inventory. Then when we look at needs for innovation on the third axis tier, we're really looking at how do we bring in new innovative programs to support overall health equity. And here are the top key concerns within the state. And when we look at that, how does that translate to the community, in the community health aspect, being able to resolve that? Overall, from a program's perspective for community health, we take all the learnings we have in occupational health and the marketing campaigns that we have within the wellness programs and engagement and behavior change, and we go through and do testbed pilots and programs across looking at outcomes-based programs, health communications campaigns, and overall innovation pilots to really extend the outreach and care. In occupational health, we have very specific communication for standards, for SOPs, policies, and overall benchmark indicators. In corporate wellness, we have to continuously support marketing on both activities, events to support behavior change. And then in broadening that to community health, we have to take all the tools within OC Health and also corporate wellness programs to implement that into community health. A couple of quick overviews as far as how those outcome programs are aligned. A lot of process development, a lot of specific requirements, and ultimately ending up in process-based outcomes and evidence-based overall delivery models. When we look at campaign-based programs, very similar areas where we leverage workforce optimization in supporting the overall knowledge base. In this particular campaign in the state, we identified that in the state of Indiana, every 1,000 babies born were out of every 1,000 babies born, 8.4 of them were dying before their first birthday because of lack of access to care. That puts the state on the same balance sheet or same inventory of total infant mortality rate as some African countries. And so when we look at that, with an access to care at the size of the US healthcare system, why are those children dying? So in campaign-based programs, we looked at resources that are already in the home, firefighters, paramedics, home health agencies, and we did a broad-based global push of knowledge to those individuals that are physically already in that space. On innovation pilot programs.
Sorry, Sunny. A few more minutes.
Okay. The state of Indiana has one of the highest opioid epidemic issues within the country. And so given that, we created pilot programs leveraging organizations that were already in the workplace, that were already part of occupational health scorecarding, that was already supporting overall corporate wellness programs to actually provide opiate reduction programs and medication-assisted treatment programs directly to the workforce. So why give these program overviews and why connect them together in this? When you merge HSE and community health, you're taking all the tools in occupational health, all of the marketing campaign-based programs in corporate wellness, and you're extending that into a community-based model where through leadership of corporations and the individual employees that are gleaning that knowledge base and applying it to, first and foremost, themselves individually, and then expanding that and applying it to others, you actually have transformative change where local resources are now the ones running your programs. Access to care becomes a behavioral change mechanism, and health equity becomes social policy, and public policy becomes infrastructure-based progress within the entire model. Based upon this, our objective for resilience, as we identified first and foremost as a future focus, as a vision casting, allows us the opportunity to not only apply the learned and utilized standards of HSE to transform communities, but with global HSE engagement, we can transform countries. Thanks very much.